Building Waliaula KT News.
The Reproductive Health Bill of 2019, which proposed to make prenatal, delivery and postnatal services free for every woman in Kenya, was withdrawn to allow public participation earlier this year. Now, the bill, the second of its kind since the promulgation of the 2010 Constitution, sought to regulate surrogacy by providing a framework for assisted reproductive services. The bill also proposed provision of reproductive health services to adolescents, which would include counseling on sexual abstinence as well as teachings on unsafe abortion and drugs. As soon as it was introduced in Parliament, it attracted criticism from mostly religious quarters who called it the abortion bill. We now want to have this conversation on News Center, and joining me in studio is Dr. Kireke Omanwa, who is the president of the Kenya Obstetrical and Gynecological Society. Thank you very much, Dr. for joining us here on News Center. Let's talk about the fact that we have a lack of proper legal framework when it comes to sexual and reproductive health. What are the implications of this?
Thank you very much for inviting me to the studio today, Ashley. And thank you very much for actually bringing up this very, very important topic. And this is a topic which affects all of us. Right from, adolescence all the way till menopause. Now, the lack of a reproductive health bill, the lack of a reproductive health law, I can just equate it maybe to the transport sector. Just imagine driving down the road. We are supposed to drive on the left side, and because there is no law, there are no laws, everybody will be driving the way he or she wants. So one can drive on the right side, another one can drive on the left side, another one can crisscross. There'll be no stopping on traffic lights. We don't know who can drive a truck, who can drive a small car, etc., etc. So it creates a lot of confusion, number one. Number two, there is no responsibility. Number three, there are no obligation, there is no accountability at all. So this is the problem that we can actually encounter when we don't have such a bill that can actually regulate who can do what and to what extent. Before
we break it down, maybe you can paint a picture of what is happening on the ground. This is something you do every single day. What is the situation?
The situation is interesting. It's interesting, first of all, the idea of the reproductive health bill which came up, I think is a fantastic idea because number one, we need to know who is doing what. Number two, we need to look at the various aspects of reproductive healthcare. And most of the time we think that reproductive healthcare is basically just getting pregnant and delivering the baby, and that's it, that's the end of it. But it's a whole spectrum, it's a whole continuum, starting from sex education or sexual reproductive education for our children who are even in primary schools, secondary schools, right even up to university. That is number one. Talking about contraception, that is number two. Talking about, safe motherhood, taking care of these mothers. How do they deliver? Where do they deliver? Who pays for the bills of their delivery? Postnatally, how are they supposed to be taken care of? Talking about those ones who have issues in getting pregnant, how are they supposed to be taken care of? Talking about those ones who have gynecological, oncological issues, and so on and so forth. What about the ladies who are in menopause and so on? Not forgetting that even men also can and do undergo andropause. So all these things should be taken together and looked at very clearly with a very sober mind so that we can have something that is actually for everybody and which can help all of us.
Okay, you started by talking about the fact that, sex education is something big that we are yet to embrace as a country, both from parents to schools. Last year, we saw rising cases of teenage pregnancies, which brought to the fore the situation on the ground. Talk to us about, if yes, we were to embrace sex education, what needs and what doesn't need to be taught at that early age?
I think, number one, we are all hypocrites, unfortunately. We have abdicated this duty We as parents, we're talking about parents. Now, if we take a step back a few, maybe one generation or two generations ago, when young people were growing up, we had these mentors. We had your aunties who were older, we had your uncles who were older, who could actually sort of initiate you into this whole process of, of becoming a mature person. Mm-hmm. Now, in times past, when a young girl started having a period, she'd be called aside by the aunties and be told, you are now a woman. And the breasts have started appearing, men will start talking to you, or men will start coming home to ask for your hand in marriage and so on. So there are certain ways, there are certain things which you cannot do. There are certain behaviors which you cannot take part in. The same thing it was with the gentlemen. Once they had the card for those societies who had initiation rites, circumcision rites, after that they were taught on how to behave as men, what to do and what not to do. Now, look at where we are today. Most of us are living in cities, we are living in towns. We have that connection with those mentors is basically not there. Mm-hmm. So there is a big gap. Now, unfortunately, what has taken that place is actually the media. Internet has come in. Most of our children will have, a smartphone, and because we as parents are not as comfortable or not comfortable at all talking to our children about sexual health, talking to our children about what to expect as they grow up. When the young ladies start having periods, what does it mean? It is nothing embarrassing. I buy pads for my daughter, and my daughter is free and tells me, Dad, can you please buy me this? And I actually go and buy. I don't have a problem like that. But you see, when you are on that line, when you're paying, men look at you funnily. Why are you buying pads? Now, I think that is where the problem is. Now, because we are not comfortable talking about that, we think that these children will have that education at school. The teachers are not equipped to actually talk about it. And what happens is that what I was supposed to teach, nobody has taught. The teacher thought that the parents would teach. The parents have not taught their children. So these children actually end up growing without this education at all. And we know that where there is a vacuum like that, something else can come in and take care of that. And that thing is actually the internet. Now, what the internet has done is that my daughter can go to school, my son can go to school. He may not have a smartphone, but other children will have a smartphone. I say, by the way, did you hear about XYZ? Did you know what a penis is? And it's like, what? What is a penis? Come and we show you. And then from there, it just snowballs. After that, the information on the internet is not regulated for age, consumption, and so on and so forth. So what they get from there is a completely distorted, convoluted picture about sexual reproduction. And then after that, we have a lot of problems later on. So I think we have a big responsibility as a society, as parents, as doctors, as teachers, as nurses, and so on and so forth, to actually come in and say, this is what we would like to do. Now, talking about what they need to know and what they do not need to know. With the time, there can be age-appropriate education. And this can be done, in terms of, you can have dolls and say, look, this is a baby, and then this is how a baby grows, and so on. We can involve teachers, we can involve psychologists who can actually create content which is age-appropriate, which should be easily digestible for the age for our children.
Okay, I like that you've mentioned a couple of things that have they've taken me back to when I was in primary school. And I would expect right now, this era that we're in, these things should be normal. Because if at that time when I was in primary school, it would be so normal to have your period. Even the boys then would tell you, excuse me, you soiled yourself, and it would be fine. So right now, who is failing who? Is it the men? Is it the society in general? Because as you have mentioned, when you pay for a pad as a man, other men look at you differently. So are the men dropping the ball?
I don't say the men are dropping the ball. I think we are not comfortable at all talking about things which are female. For me, as a consultant gynecologist, I mean, this is my bread and butter. But then somebody else who's an engineer, somebody else who is a pastor, somebody else who is doing other things, a lawyer and so on, may not be as comfortable, talking about these things. But that notwithstanding, these are our children, and we need to honestly calm down and have a serious discussion with ourselves and then with these blessings which God has given us, such that when my son goes to school and there is in a school whereby there are girls and one starts having a period or whatever it is, it should not be ridiculed. Say, oh, by the way, can you go and, sort yourself out? There is something which is happening. Instead of pointing fingers and say, angalia uyu, look what is happening, which again traumatizes, the young girls later on, unfortunately.
Okay, I want us to take a short break, but when we come back, we'll be continuing with this discussion. So much that we need to talk about, including that big elephant in the room, that is abortion. Around 450,000 deaths are procured, cause of abortions, actually, 450,000 abortions a year. So we need to talk about that. And the deaths that come out of the complications that come about from abortions. This and much more coming shortly on News Center.